Alright everyone, today is April 1st. I know I said I was going to post another video on Monday, but I ended up having complications from my surgery and ended up having to go back into the hospital. So if you guys remember, I said that a few days after my surgery I had to go back to the doctor's office and speak with my doctor about all the pain that I was having. They kept telling me that it was normal pain that was associated with the surgery, and that it was something that would pass, but it wasn't. Of course, I managed to make it a total of 5 days after my surgery, and it was Sunday night. I forget the exact date. I'm trying to remember what date that was. I think it was the 28th. I want to say I ended up having to go to the emergency room. The pain in my back had become so bad that and the sciatic pain was just off the scale. It was 10 times worse than what I actually had before the surgery, and I was just ready to cut the leg off. It hurt so bad. So I went back into the hospital. The ER department decided to do a CT scan with contrast. And what they discovered was when I had the surgery, when they removed all of the herniated disc portion and removed the bulging disc, they shaved all of that back, had gone up inside the disc and pulled out broken fragments that were inside of there. It left this empty cavity that now gave the nerve lots of room to move. So like I said, after I had the surgery, I felt like $1,000,000. I had very mild nerve pain, and everything was going great. I felt wonderful. The few days had passed, and then all of a sudden the onset of pain started coming on, and it progressively got worse and worse and worse. So what they said was the excessive bleeding that I had, if I had a way to show you guys a picture, I don't know how to insert pictures on these videos, but basically I had bruising from just below the incision all the way down both butt cheeks, all the way to the bottom of my butt cheeks. I had, it looked like somebody had just beat me with a baseball bat until I was black and blue. Although that excessive bleeding had settled into that new open freedom spot that my nerve was living in, and had turned into a massive blood clot. And so when the ER did the CT scan with contrast, it came back showing that I had a 1-inch blood clot sitting on top of the nerve. That blood clot was just pinching the hell out of the nerve every time I would move, and it was generating so much pain. I stand 6'2" tall. I think at my worst point I looked like Quasimodo. I was bent over. I was about 4'11". Looked like somebody had drop kicked me in my right side. I was bent to the right, bent forward. I could not straighten out to save my life. And so they decided to admit me back into the hospital. So Sunday night I was admitted into the hospital. Sunday early morning I was admitted into the hospital, and I stayed there for 2 days. they were doing on-site pain management within the hospital. The following morning after I had been admitted, my doctor came in and told me that he looked at the CT scan and he didn't see anything, you know, wrong with the CT scan, and didn't understand why I was feeling all of this pain. I told him, I said, a radiologist who looks at these CT scans for a living told me that I had a 1-inch blood clot on there, and I didn't appreciate the fact that he was bullshitting me on the blood clot that I had in my back. Because the blood clot was not, you know, in a blood vessel or anything like that, it was no concern to go in and, you know, put me back under the knife, reopen me back up, and try to remove the blood clot. They applied a little bit of blood thinner into my IV. They gave me, you know, several meds through my IV, and they changed my prescription from these little, why they sent me, to this day I cannot wrap my head around why they sent me home from surgery with Norco 5s. I was eating so many of those Norco 5s that I was practically overdosing on the acetaminophen, which is nothing more than Tylenol. The 325 milligrams of Tylenol to the 5 milligrams of hydrocodone pain medication that they put in those pills. Any doctor that's going to send you home with anything less than a Lyrica or a Percocet 10 or anything like that, you need to find a new doctor, or tell them to take their prescription back. You'll get your medication someplace else. This surgery, you're going to be dealing with a lot of pain, and Norco 5s are an absolute joke. So I had to deal with quite a bit at the hospital, and frankly, excuse the language, but I was fucking livid. I was pissed. My doctor walked in and tried to tell me that there was nothing wrong, this was just normal pain, and that I just needed to man up and deal with it. I have dealt with pain. I have had serious pain. For those of you who have ever had an inguinal hernia surgery, that is pain. This pain that I was feeling surpassed the inguinal hernia pain that I had. And this man tried to tell me that Norco 5s were sufficient for the type of surgery that I had. But anyway, after having a you know, an argument, flat out just cussing my doctor from one end to the other, nurses, everybody else, pain turns you into a demon. When you get to your breaking point and you just cannot stand it any longer, you become a very different person. I am a very well-mannered type of person. I have a very open, very nice demeanor to me. I treat people with the utmost respect. I am a very nice guy. I turned into Satan in that hospital room. I was in so much pain. After telling my doctor to get the hell out of my room, he tells me that he's got surgeries all day long, so I either talk to him now or I don't talk to him at all. So I was like, all right, doc, you want to talk? Let's talk. And then I spilled out, you know, everything that I could think about him and my true feelings about him and his surgery on my back. And he left the room. He wasn't too pleased with what I had to say to him. He came back a few minutes later and he said, look, I will change up your medication, and I will put you on something different. I had been taking 2,700 milligrams of gabapentin, or some people call it Neurontin, and it was doing absolutely nothing. I've been taking this stuff for almost 6 months. It was doing absolutely nothing for my nerve pain. So he changed my prescription from gabapentin to Lyrica. I take 300 milligrams of Lyrica twice a day, so I'm taking a total of 600 milligrams a day of Lyrica. He changed my pain medication to Percocet 10s, and he gave me Valiums for muscle spasms. I was having a great deal of muscle spasms because of my body trying to just support everything to take the weight off the pain that I was having in my back. So the Percocets, the Valium, and the Lyrica, as you can see now, I am up, I am moving around, I feel like a brand new man. Night and day. I am so thankful that they finally got it worked out. Here it is. It's almost my 2-week. This coming Monday in 2 more days will be exactly 2 weeks from my surgery. I feel like I could run a marathon, but I'm not. I'm more active. I'm able to get down on the floor, play with my 2-year-old son, take him to the park, and the leg pain that I have, it's very mild. I had a pain of off the scale of 11. The medicines got it turned down to a 2. So I'm doing great. And if I end up with permanent nerve damage, which it looks like I'm going to have some sort of permanent nerve damage, but with the medications that I'm on, the Lyrica, if you have not tried it, if the medications that you're on are not working, ask your doctor about Lyrica. It's working wonders for me. Like I said, it's really got my nerve pain in my leg turned all the way down. It is something that is very tolerable now. I'm not supposed to lift anything over 5 pounds for the next at least month, and then here I think within about another 2 weeks they're going to start physical therapy on me. So I'll give you guys a follow-up and let you know where I'm going from there. So I'll maybe give you a 1-month update once I start getting some physical therapy in me, see how we're doing. But I'm able to go to the grocery store, walk around the store, go to the park all day with my kid, do lots of walking without any excessive back pain. Now, at the end of the day, of course, you know, being up and being active, I get a little soreness and stiffness, and you know, wake up in the morning with a little soreness and stiffness, of course, but take my meds and get up, work out all the stiffness. Like for instance, this morning I had a real bad encounter with muscle spasms. So that's what the Valiums are for. So I think every muscle in my lower region, from my calf muscles all the way up to my groin, my buttocks, I think everybody got together and said, hey, let's have a party this morning and let's knock this guy up. So I had a pretty rough morning, but got some medication in me and got it under control. Here I am now, up, running around, doing good. So the pain, like I said, is pain's been brought under control. Doing good. So I'm looking forward to starting some physical therapy and getting my body worked out again, and getting back to, you know, an active lifestyle again. So had a little hiccup in my surgery. Like I said, some of these videos that you see on YouTube discuss, you know, having the surgery, and they've been wonderful and everything's been great and they lived happily ever after. Sometimes you have problems. My situation, like I said, had a little bit of a hiccup in my recovery, but we've got it worked out, and things are going great. You're thinking about having this surgery. There are some things that can happen. There are things that, you know, may not happen. You may have a perfect surgery, perfect recovery. This is just my video review of it, just to give you an idea of, you know, of what could happen. I'm hoping that, you know, if you're watching these videos, it gives you an idea of what to expect, you know, the good things that can happen, the bad things that can happen. So, I'm 43 years old, and I feel like I'm 42 years old now. No, I'm feeling really good. I'm feeling a lot better than I have in a long time. So the surgery, it's done good for me. So I wish you well if you're having this procedure done. I wish the best for you, and like I said, just don't be afraid to ask questions, and don't be intimidated by your doctor. Some of these doctors walk around with their heads up their asses and they don't listen to the patient. If you feel like you're having some sort of a problem, you know your body better than anybody else, and if they're like, this is normal, keep pushing it. You tell those doctors that this is not normal. I am feeling something that I don't think is normal. I want it looked at, and if you have to go to the emergency room, if you have to go see another doctor, do it. Because if I had just sat back and I just kept listening to these doctors, it could have ended up bad for me. I don't know what else to say. I know this video is getting kind of long, but I just wanted to, you know, like I said, give you an updated report on how I'm doing. Feeling much better now, and I'll come back in about a month. I'll give you my 1 month update, or maybe sooner. Maybe I'll come back and I'll give you an update after I start my physical therapy, and I'll let you know how things are going from there. All right, you guys have a blessed day, and you guys take care. And you know, and if you haven't had the surgery yet, don't be scared, but just talk to your doctor about it, and just you know, do your research, and you know, let's just go from there. All right, well, you guys have a great day, and I'll get back to you guys, like I said, maybe after some physical therapy, or give you a 1 month update. All right, you guys take care.